guidelines.
So thank you, Dr. Subudhi, for that introduction. Let me speak about the government guidelines in telemedicine. Basically, during the time of COVID, an amendment was incorporated into uh, in the Indian Medical Council Professional Conduct Etiquette and Ethics Regulations 2002 by adding Regulation 3.8 titled as Consultation by Telemedicine in the said regulation. So the very definition of telemedicine, World Health Organization defines telemedicine as the delivery of healthcare services where distance is a critical factor by all healthcare professionals using information and communication technologies for the exchange of valid information for diagnosis, treatment, prevention of disease and injuries, research and evaluation, and the continuing education of healthcare workers with the aim of advancing the health of individuals and communities. Then they have specifically defined an RMP as a registered medical practitioner is enrolled in the state medical register or the Indian medical register under the said act. The definition of telehealth, the delivery of and facilitation of health and health-related services, including medical care provider and patient education, health information services, and self-care via telecommunications and digital communication technologies. In general, telemedicine is used to denote clinical service delivered by the registered medical practitioner, while telehealth is a broader term of use of technology for health and health-related services, including telemedicine. So, the mandatory online course was suggested by the government. Still, nothing has happened, so I need not skip. The online course, it is yet to be introduced. We were supposed to enroll in it, take a sort of a certification from that, and then practice telemedicine. But as on date, it is not in vogue. So basically, the guidelines for telemedicine in India are divided into 7 aspects. Number 1, the context of teleconsultation, identification of an RME and the patient, identification both ways, mode of communication, consent, type of consultation, patient evaluation, and patient management. So the RMP should exercise their professional judgment to decide whether a telemedicine consultation is appropriate in a given situation or an in-person consultation. They should consider the mode of technologies available for their adequacy of diagnosis, and the RMP shall uphold the same standard of care as in in-person consultation, but within the intrinsic limits of telemedicine. Mind you, there is no immunity. Tomorrow, if something happens, the case is filed in the court of law, you can't complain, entertain immunity saying that it was only a teleconsultation. You are perfectly liable. The patient should verify that and confirm the patient's identity. Where the patient is a minor, after confirming the age, teleconsultation is allowed only if the minor is consulting in presence of an identified adult, and every RMP shall display the registration number on prescription website and electronic communication. Multiple technologies can be used to deliver telemedicine consultation. Primary 3 modes: video, audio, and text. Basically, video consultation is essential for primary consultation. There may be situations where, in order to reach a diagnosis and understand the context better, a real-time consultation may be preferable over asynchronous exchange of information. In that case, you need to examine the patient with a physical consultation. Then the consent. The consent, basically, there are 2 types of consent, implied or explicit, depending on the following situation. If the patient initiates the telemedicine consultation, then consent is implied because he has approached you. Whereas an explicit patient consent is needed if a health worker, RMP, or a caregiver initiates a telemedicine consultation. If the consultation is initiated from your side, it is explicit. You need to have a proper consent. If the patient initiates the consultation, that is implied. Then the patient information, the RMP should use his or professional discretion to gather the type and extent of the patient information, and information should be supplemented through conversation with the healthcare worker provider. And if the RMP feels the information received is inadequate, a physical consultation should be mandated. And telemedicine, as Dr. Madharia and Dr. Kim said, like it has its own set of limitations, and in-person consultation in such situations may be required. The guidelines for telemedicine, basically first and follow-up consultation means the first consultation should be a video consultation and adequate steps should be taken. Follow-up consultations can be done through telemedicine or whatever is the necessity. Because of the paucity, Dr. Subudhi restricted my 2 minutes, so I have to rush through the slide. Basically, the patient management, basically, when you are prescribing medicines, you need to follow this list, like TIA list O, which over-the-counter medication, A, with a video consultation, B, after a video consultation, if you need to add medication, you can, and prohibited list should never be prescribed. And there is a particular format for online consultation where you need to specify your degree, your name, your registration number, and all these things have to be incorporated. Thank you very much.
Thank you, sir, for hurriedly going through the guidelines. These are very elaborate guidelines. Yeah,
No,
sure.
it is a 6 minute talk, don't worry.
Yeah.
Sir, I would like to add one thing. In India, like you said, they have not included this telemedicine in the medical course, but other countries, they have started doing it. Like in United States, they have included this
Yes.
in the medical courses.
Yes, ma'am. Basically, necessity is the mother of invention. Like, luckily for us, COVID didn't prolong much. Had it continued for, say, another 6 months or so, these guidelines would have come.
Yes.
The government was busy doing the main things first required things, and this took a backseat.
Yes.
Actually, it is evident, like if they really float an online course, it would be better. I think the NMC should take care of this. They should suggest an online course. We should all go through that. And from AIOS side also, I have it in mind. I delayed it deliberately last year. Probably in the next 6 months, I may be trying to roll out a basic teleconsultation app from AIOS side for us. Because the government has not initiated much. What we will gain by initiating apps straight away is at the back of my mind.
Thank you, but
great.
we need
That's
support
great.
from AIOS.
Yeah,
As you
yeah. There should be some platform rolled out from AIOS,
Yes.
Teleoftel and other things. So on a user,
Even if not for primary consultation, for a follow-up consultation or
Today
this,
we have
a
GP1.
basic
on a use and
Guidelines
pay
should be
basis or
there.
something, it
Some
should be done.
guidelines we should prepare from
Unless
the
you have 200
AIOS.
members, you can